we see four different diseases, and what most people aren't aware of is that they're actually all the same thing. Most commonly referred to as Lou Gehrig's disease, the formal name for it is amyotrophic lateral sclerosis, or ALS. Today I'm going to talk about understanding ALS. Amyotrophic comes from the Greek language, which translates into no muscle nourishment.
First baseman Lou Gehrig hung up an amazing mark by playing in 2,130 consecutive games. Then a fatal disease attacked baseball's Iron Man. In Yankee Stadium, touched to tears by the tribute, Gehrig made his last public appearance.
For the past 2 weeks, you've been reading about a bad brag. Today, I consider myself the luckiest man on the face of the earth. When you look around, wouldn't you consider it privilege to associate yourself with such a fine-looking man as is standing in uniform in this ballpark today? That I might have been given a bad break, but I've got an awful lot to live for. Thank you.
Lou Gehrig was diagnosed with ALS on his 36th birthday. Prior to his diagnosis, Gehrig noticed several of the disease's symptoms while playing on the field, which included loss of strength, slipping and falling, and loss of coordination. Shortly after his diagnosis, Gehrig chose to retire from baseball. The Yankees honored him by celebrating Lou Gehrig Appreciation Day at the Yankee Stadium and honored its first baseman for his sportsmanlike behavior and dedication to the game. On this day, nearly 62,000 fans listened to Gehrig as he gave his famous speech, where he deemed himself the luckiest man on the face of the earth. Gehrig lived for almost 2 years after that speech. ALS is a progressive nervous system disease that affects nerve cells in the brain and spinal cord, causing loss of muscle control. ALS is often called Lou Gehrig's disease after the baseball player who was diagnosed with it. Doctors don't usually know why it occurs. Some cases are inherited. ALS affects the nerve cell that control voluntary muscle movements, such as walking or talking, and it causes the motor neurons to gradually deteriorate and then die. Motor neurons extend from the brain to the spinal cord to the muscles throughout the body. When they are damaged, they stop sending messages to muscles, so muscles can't function. ALS often begins with muscle twitching and weakness in a limb or slurred speech. Eventually, ALS affects control of the muscles needed to move, speak, eat, and breathe. There are two different types of ALS, sporadic and familial. There is no cure for this fatal disease. The onset of ALS often involves muscle weakness or stiffness as early symptoms. Progression of weakness, wasting, and paralysis of the muscles of the limbs, as well as those that control vital functions such as speak, swallowing, and breathing, generally follow. Once ALS starts, it almost always progresses, eventually taking away the ability to walk, dress, write, speak, swallow, and breathe, and shortening the lifespan. How fast and in what order occurs is very different from person to person. Progression is not always a straight line in an individual either. It's not uncommon to have periods of time where there is little or no loss of function. ALS is a very difficult disease to diagnose. There is no one test or procedure to establish the diagnosis. With a clinical examination of a series of tests and ruling out other diseases that mimic ALS, a diagnosis can be established. Researchers continue to study possible causes of ALS. Most theories center on a complex interaction between genetic and environmental factors. Treatment can slow down the disease progression and prevent further complications. There are currently 4 drugs approved by the U.S. FDA to treat ALS. Therapy, breathing care, physical therapy, and speech therapy, as long as a balanced diet and nutrition, will help make life more comfortable. Scientists have made significant progress in learning more about this disease. Studies are ongoing to develop more treatments and a cure for ALS. Studies have shown that participation in a multidisciplinary ALS clinic may prolong survival and improve the quality of life. As the disease progresses, ALS can cause complications such as breathing problems, as ALS paralyzes the muscles used to breathe, speaking problems, which may lead to a tracheotomy, eating problems, as ALS can develop malnutrition and dehydration from damage to the muscles that control swallowing, as well as dementia. Some people with ALS have problems with memory and decision making, and some eventually get diagnosed with a form of dementia called frontotemporal dementia. The most common cause of death for people with ALS is respiratory failure. While the average survival time is 3 years, about 20% of people with ALS live 5 years. 10% will survive 10 years, and 5% will live 20 years or longer. In 2014, my beautiful grandmother posted a video on Facebook of her doing the ALS Ice Bucket Challenge and nominated me to participate. To be honest, I had no idea what ALS was, but everyone was doing the challenge, and I knew it was for a good cause to benefit ALS patients and their families. And I did not want to let my grandmother down. But I never in a million years thought that one day I would be one of those family members with a loved one diagnosed with ALS. Never mind that loved one being my grandmother. So, as I just said, my grandmother was diagnosed with ALS, and these are her own words about how it's like being diagnosed with ALS. It all started 5 years ago when I was having a problem with my left arm. Saw my primary care doctor, and she sent me to a neurologist who did an ECG. And then I saw an orthopedic doctor, and he did another ECG, sent me to his colleague who did another ECG. 3 years later, I ended up in the hospital, and on 3/25/19, I was diagnosed with ALS. I accepted it right away, and through my spiritual belief, I am still here today. I was sent to an occupational therapist and speech therapist. They both are experienced ALS therapists. My occupational therapist showed me exercises to do to keep my muscles strong. I do a breathing test with a cough assist 2 times a day. I also have a different kind that I do once a day. I sleep with a mask that remembers my breathing. The reason for all this is to keep my lungs and diaphragm going. Now, this is what she wrote about what it's like to live with ALS. It has been 2 years since my diagnosis. I take one day at a time. It has affected my speech and swallowing. I had a feeding tube placed to help me get extra water because I have trouble swallowing it. ALS is a disease that is hard to diagnose, and it attacks your muscles and respiratory system. They say you usually last 3 to 5 years after diagnosis. Everyone is different on how you progress with the disease. I am still able to walk. I knew about ALS. I did the ALS challenge, but I did not know anything about the disease. It changes your life and everyday activities. I have a caretaker and a PCA that help me daily. I do daily exercises and stay positive every day. My spiritual beliefs help me a lot. I also take a supplemental feeding once a day. The water keeps me hydrated, and my supplement is full of protein. These 2 things are very important. Most people who develop ALS are between the ages of 40 and 70, with an average age of 55 at the time of diagnosis. ALS is 20% more common in men than in women. However, with increasing age, the incidence is more equal between men and women. About 90% of ALS cases occur without family history, which is known as sporadic ALS. The remaining 10% of ALS cases are inherited through a mutated gene, which is known as familial ALS. For unknown reasons, military veterans are up to twice as likely to be diagnosed with the disease as the general public. I am dedicating this informative speech to my hero, my grandmother. I have never met someone as strong as she is, and she is always positive and keeps everyone positive. I hope that more people become aware of this disease, and I pray every day for a cure. Anyone has any questions, feel free to ask. Thank you for watching my speech, and God bless.